when you come to the office with an elbow complaint, my job is to figure out where your complaints are coming from. Are these bone and joint issues? Are these tendon and ligament issues? Or are these neurologic in nature? As part of my practice, not only do I see a lot of hand and wrist conditions, but I also treat a lot of elbow conditions. Probably the most common things that I see in the elbow are either traumatic events to the elbow, so elbow fractures, or ligament ruptures, or tendon ruptures around the elbow, or arthritis of the elbow. In terms of elbow fractures, very common when we have high energy mechanism traumatic events like bike crashes, mountain biking, or car accidents. These are things that can oftentimes lead to a fracture around the elbow. As well, sports injuries, throwing athletes can have ruptures of ligaments around the elbow. Again, that can also be caused by a traumatic event. And then tendon ruptures around the elbow, such as a distal biceps tendon rupture, are common conditions that I'll see in the office. As well, elbow arthritis is fairly common as well. Oftentimes this can be due to old traumatic events or rheumatoid arthritis or other inflammatory conditions that can lead to degeneration of the cartilage around the elbow and can lead to painful, stiff elbow. And these are conditions that I'll oftentimes see in the office. So when you come to the office with an elbow complaint, my job is to figure out where your complaints are coming from. Are these bone and joint issues? Are these tendon and ligament issues? Or are these neurologic in nature? And one of the things that I will do in the office is a thorough physical examination. We'll assess the range of motion of your elbow. We'll assess the stability of your elbow. And I'll also assess all the main nerves that run up and down your arm to really elucidate whether or not your condition is really neurologic in nature, soft tissue in nature, or bone and joint related. Some of the tools that we have at our disposal as well are X-rays. X-rays are really helpful to look at the condition of the joint itself and the bones about the elbow. Oftentimes we can order an MRI, which are really helpful in terms of the soft tissues about the elbow, the ligaments, and the tendons around the elbows. And then there are neurologic tests called EMG, nerve conduction studies, and these are helpful in terms of diagnosing any neurologic issues about the elbow, the most common being cubital tunnel syndrome, which is compression of the ulnar nerve at the elbow. So the good news is most elbow conditions respond really well to non-surgical treatments such as rest, physical therapy, PRP injections, steroid injections. But if you fail those non-surgical treatment modalities, we have a wide variety of tools that we use in the operating room in order to treat your elbow condition, whether it's arthroscopic surgery, whether it's endoscopic surgery, whether it's open fracture surgery, or even open soft tissue techniques that allow us to restore the function of your elbow and ultimately restore your abilities to play the sports that you like to play, do the hobbies that you like to do, or do the work that you like to do.